Hello and welcome to this interview as part of the AFOMP contribution to the Medical Physics Week. My name is Mohammad Amin Mosleh Shirazi. I'm a member of faculty and head of radiotherapy physics at Shiraz University of Medical Sciences. I would like to thank the AFOMP XCOM for inviting me to conduct this interview. This interview is regarding the award of Best PhD, and it went to Dr. Pegah Saadatmand, and we will ask her to give more introduction of her work and herself. By way of further introduction, I'm serving the AFOM as a member of the science committee, and I'm very honored to be part of the efforts for this week. Dr. Saadatman, thank you for accepting our invitation, and please give a, a brief introduction of yourself. Thank you.
Great, Doctor. Nice to meet you. Thank you. Thank you very much for giving me this opportunity to be part of this interview. And I'm really grateful to AFOM for creating a platform where a young medical physicists can share their work experience with wider professional community. My name is Dr. Pegah Saadatmand. I'm a professor of medical physics, and as well as I work as a clinical and radiotherapy medical physicist. I graduated from medical physics in 2025 from Iran University of Medical Science, and my research focuses on radiotherapy, especially on using AI-based predictive modeling to improve treatment outcome. During my PhD, I work on the predicting radiation-induced toxicity, and I was honored to receive the best AFOMP Best PhD Award in 2025 for my research in this area.
Okay, thank you so much. Could you give us some more detail briefly on on your topic and why it's this research was important and how does it contribute, please?
Yes, of course. My PhD research was about prediction of skin toxicity as a common side effect of breast cancer patients undergoing chemotherapy. And the main idea was to figure out if we could identify high-risk patients in the treatment planning process, so we could adjust their treatment plan to avoid toxicity. For this purpose, we started by looking for simple dosimetric marker using DBH data, and then expanded by incorporating dosing mix and machine learning approach to capture more detailed special information. The result of work are published in scientific reports journal in 2025 years and in European Journal of Medical Research in 2025. And briefly, I can say that the main goal of our work is finding the people that may experience high grade of skin toxicity and adjust the treatment plan to avoid treatment-related complication.
Excellent. And how does it contribute? What is the clinical importance of your work, please? Could you elaborate a bit more on that, please? in terms of the clinical
What is
importance?
the Yes, of course. Um, the main message or the clinical importance of work is refer that skin toxicity risk is not random and it can predicted from treatment planning. And our result show that it can estimated from simple dosimetric best marker. For example, we introduce the best predictor of V51 grade, which means that if you try limit the skin volume that receive 51 gray in the treatment plan, you can reduce the skin toxicity risk in the patients.
Excellent.
And another, thank you. And another reasons or another application of one of my thesis is refer that skin toxicity and not just related to the value of dose, but also the pattern of dose distribution across the skin influence whether patients may experience toxicity.
Excellent. Okay, as you know, the theme of the Medical Physics Week this year is sustainability. It is believed that medical physics has a big role, can play a big role in that part. Can you think of ways and can you link the results of your PhD and further the kind of overall contribution of modeling, radiobiological modeling or any kind of computer modeling to this effort for sustainability, please? Thank you.
Sure. I think sustainability in healthcare, especially in radiotherapy, is about improving clinical effectiveness while also optimizing the use of resource and reducing treatment-related complications. So from this perspective, our work contribute to sustainable by enabling early prediction of radiation-induced toxicity using deviation dosimetrics-based models, and by identifying high-risk patients during planning stage, clinician can adjust their treatment strategy instead of reacting to complication after they occur. And they may reduce toxicity-related intervention, extra follow-up, or even treatment modification. So this approach overall can improve both patients' outcome and treatment quality or efficiency of care delivery.
Thank you. More towards the actual sustainability issue, do you agree that modeling in general, computerized modeling, can spare a lot of resources? Doing some of the things experimentally, building, for example, equipment, etc. In general, more further from just your work. However, I believe that your work also, some of the things you found out, if you wanted to do it experimentally, you would need a lot of resources. Whereas here you have a predictive model, and predictive model can get make cost savings, resource savings, etc. Do you agree with this? That modeling is a method of improving sustainability and basically saving resources?
Yes, of course. I think that in further, I believe the predictive modeling will be a regular part of treatment planning, further supporting personalized radiotherapy, and medical physicists can contribute to sustainable healthcare by ensuring that treatment are well optimized and personalized and by this is done by supporting the safe and effective use of new technologies like this AI-based predictive modeling.
Excellent. Okay, so coming back to the issue of the award that you received, uh, what does it mean to you having received this award? And how has it helped you, or how can it help you to further your career?
Yes, this award means a lot to me, both personally and professionally, and it motivates me to continue doing research that is clinically useful and scientifically careful.
Excellent. Um, and making this wider in terms of the AFOMP's role. Uh, as you know, our national member organization of the Iranian Association of Medical Physics has become more tried to become more active in the international community of medical physics, and in particular by joining the AFOMP. We've tried to be a part of this bigger family. Now, how do you see AFOMP's role in furthering and improving the career, the situation, the training, etc., of young scientists like yourself?
Um, I believe AFOMP play an important in strengthening medical physics community, and they provide a platform for education, collaboration, and scientific exchange among professionals from different countries. AFOM help connect to the community and create opportunity for learning and professional growth.
Excellent. Thank you very much. As a final question, or almost final question, what is your message to other young scientists doing their PhD degree or master's degree or whatever, who want to go and go to higher and more useful fields to contribute more? I mean, what is your message to them, please?
My message or my advice to a young professional is stay curious, be patient, and never forget that behind every calculation and every treatment plan, there is a patient. So if you keep that in mind, you will do well in this field.
Excellent. Very nice perspective on that. Well, I would like to thank you, Dr. Pegah Saadatmand, for taking part in this interview. If there is anything else you would like to add here.
I want to thank from AFOM because AFOM has helped me to feel more connected to wider medical physics community and broaden my perspective and encourage me to keep growing in this field. Thank you again. I want to thank you for this opportunity to supporting a young professional like myself.
Excellent. Thank you so much. I would also like to thank AFOM community. Um, in turn, thank the Iranian medical physics community for producing young and talented scientists like Dr. Saadatmand and many more. and I wish them best wishes for further years and for further success. And I personally also like to thank for this opportunity to be part of this program. And with that, I would like to say goodbye and thank you for your participation. Thanks very much.
Thank you for your time and have a great day.
You too. Thank you. Bye bye.